Hi everyone, my name is Carrie Ann Salemi. I am the program manager for the city's Substance Use Disorder and Homelessness Initiative Office. I am here with my coworker Nicole Palermo, the city's clinician for the SUD office. We are here in observation of Fentanyl Awareness Day. We're going to talk to you a little bit about what fentanyl is, and I'm going to turn it over to Nicole.
Hi everyone. So what is fentanyl? Fentanyl is a very potent synthetic opioid that is 50 times stronger than heroin and 100 times more potent than morphine. Typically, it's used in medical settings for cancer patients or those recovering from very painful surgeries. In its prescription form, it is used for pain, but fentanyl is also made illegally and is one of the most common drugs involved in overdose deaths. It is very fast-acting, and ingesting even a small amount can cause an overdose. Some of the risks of fentanyl include taking an amount of the drug that is greater than your tolerance level. Your tolerance level can change after periods of abstinence, for example, leaving a jail or a prison or leaving treatment of any sort. Your tolerance level is not going to be the same as it was when you were continuously using, so that's a higher risk. Combining different drugs like opioids with other sedating substances such as benzos or alcohol is another risk factor. Using drugs alone without notifying someone who can respond and make sure that you are breathing or being able to be administered Narcan is also a risk factor. And using similar drugs to the one that you have experienced a prior overdose with is another risk factor. Fentanyl poisoning symptoms include shallow breathing, confusion or dizziness, loss of consciousness, blue lips or fingertips, pinpoint pupils, respiratory failure, or a gurgling sound. Now that you all know a little bit about fentanyl poisoning and some of the risk factors, I'm going to pass it back over to Carrie Ann to talk about some treatment options and how to reverse an opioid overdose.
Thank you, Nicole. So when we're talking about treatment for fentanyl, immediate medical intervention is crucial. Supportive care to maintain vital functions, naloxone administration to reverse an opiate overdose. Monitoring for respiratory depression and providing oxygen therapy is needed. So how do you respond to an overdose? Well, it's a very simple technique. First thing you're going to do is you're going to call 911. You're going to put your phone on speaker. You're going to try to stay calm and check to see if the person is breathing or has a pulse. If you get no response, after shaking the person, you're going to take your knuckle and you're going to put it right in the middle of their chest and rub it as hard as you can. That's called a sternum rub. And that will, if somebody is in a nod, that will wake them up. If it doesn't wake them up, then that's when you have your naloxone available. You're going to peel back the cover, take the nose spray, put it into one nostril and just tap the button. That medicine's gonna shoot. It's gonna go on the opiate receptors and knock the opiate off and hopefully restore the breathing. You wanna provide first aid if the person stops breathing with CPR. The most important thing to do in an opioid overdose is to give rescue breaths. So you would push the chin back, pinch the nose, breathe. If you see the chest rising, you know you're getting air into the person. And you could keep them alive until EMT gets there just by rescue breathing if you did not have naloxone. So some of the prevention methods include proper storage and disposal of any prescription fentanyl, education on the dangers of fentanyl misuse and overdose, access to naloxone kits in communities to reverse overdoses, and we also have access to fentanyl test strips so that you can test your drugs and know if fentanyl is in it. So in conclusion, fentanyl poisoning is a serious health concern with potentially fatal consequences. Awareness, prevention, and timely intervention are key to reducing its impact.
Thanks, Carrie Ann and Nicole. My name is Drew Bunker, and I'm a primary care doctor in Revere at MGH. Treating patients with opiate use disorder is something I do on a day-to-day basis, and as many as you know, this is unfortunately a high-stakes and often deadly disease. I approach it in 2 steps. First is harm reduction. This includes understanding how much patients are using, if they're using alone, are they sharing needles. All this information is helpful in how I dictate testing for infections and it also lets me offer counseling to ensure they have naloxone and are not using alone. Second step is I discuss treatment. There are two excellent evidence-based ways to treat this disorder. One is Suboxone and the other is methadone. I can provide Suboxone in office. Methadone is administered in a specialty clinic. I encourage patients to have open dialogue with providers, and I try to offer non-judgmental and supportive advice because addiction is often shameful and isolating. I hope that this was helpful for you today.
On Fentanyl Awareness Day, we urge the community to recognize the grave dangers posed by this synthetic opioid. From a police perspective, we've witnessed firsthand the devastating impact of fentanyl on our streets. Its potency far exceeds that of heroin, often leading to fatal overdoses even in small doses. The clandestine production and distribution of fentanyl compounds its threat as it frequently finds its way into other drugs unbeknownst to users. Heightened awareness, education, and collaboration between law enforcement and communities are crucial to combating this epidemic and saving lives. And now, we will hear a few words from our Criminal Investigation Bureau.
Hello, my name is Captain Maria Levita, and I wanted to talk today about what the Revere Police Department has been seeing in terms of the types of narcotics we are encountering. While we are still seeing fentanyl and cocaine in powder forms, as well as crack cocaine, we are continuing to see counterfeit pills that contain extremely dangerous substances. These counterfeit pills often appear to be identical to real prescription pills. We have found blue pills being sold as oxycodone, as well as yellow tablets being sold as Xanax, both of which contain the deadly narcotic fentanyl. Equally as concerning is that we have seized pink pills sold as Adderall, which were found to contain methamphetamine. This is particularly dangerous considering the pills mimic the appearance and effect of the authentic pharmaceuticals. It is never safe to purchase or consume pills from anyone other than a licensed pharmacist. If you or someone you know is struggling with addiction, please refer to the information below. And also please visit our website for information on how to submit tips about the illegal distribution of narcotics in the city. Thank you.
As the result of the pharmaceutical pain pill crisis in the late 1990s and early 2000s, it has led to levels of addiction to opiate-based narcotics that the United States has never seen before. Currently, there are over 2,000 overdose deaths per year in Massachusetts and over 100,000 overdose deaths per year nationwide. Over 90% of these deaths are due to this abundance of the potent synthetic opioid fentanyl, which can come in the form of lace pills and other drugs to include heroin and cocaine. Fentanyl is 50 times stronger than heroin and 100 times stronger than morphine. The opioid crisis has become an epidemic in the United States that has no boundaries to socioeconomic class. It has affected all walks of life, and most families have experienced some form of addiction in their household. The Revere Police Department works collaboratively with many of our community partners, to include the City of Revere's SUDI office and the drug court at Chelsea District Courthouse, trying to support people suffering from addiction and to educate the community on the dangerous effects of illegal drugs.